The next series we're gonna do is fingers. So I'm gonna have Lucas place his finger right in the light. And then usually we like to minimize the movement of our patient. So we typically will move our tube. In this case, we're gonna go for the first digit and centering at the metacarpophalangeal joint. If you would like, you can also turn the collimator so that it runs down the finger or the digit itself. Then we're gonna collimate to just that first digit, second digit. And make sure there is light at the tip of the second digit, and then make sure it goes all the way down to the carpals as well. And then the other position would be our oblique. So similar to an oblique hand, we're gonna have Lucas raise his hand up so that it's oblique. Aim for the second digit again, and in the same position, or the same centering at the metacarpophalangeal joint. Make sure we include all of the anatomy and open up as need be. And then finally for our lateral, we're gonna position his hand in a lateral hand position. And with these, we want him to curl his third, fourth, and fifth fingers or digits. And then also aiming at the metacarpophalangeal joint. And then make sure there's enough light on both ends, at the distal and the proximal end. So for some tips and tricks for imaging our lateral fingers, as you can see in the other one, I just kept Lucas in the lateral hand position or lateral wrist position. But if your patient is capable of doing it, you can always have him rotate internally so that we place the anatomy as close to the eye as possible, because this will prevent any OID from occurring, which also helps with our images to be a lot nicer. And then also when we're doing other fingers, for example, maybe the fourth or the fifth digit, some of our patients are unable to isolate the finger like Lucas can. So one option we provide our patients with is a sponge or anything that is radiolucent to help hold the anatomy into the position we need. And in this case, I can always ask Lucas to hold the sponge for me. And then as he does that, we'll just adjust him accordingly. Make sure that all the anatomy is in the light field. And that will help with positioning our lateral fingers.